Well, throughout the year, we raise awareness about various issues, communities, and topics. Today on Community Connections, we'll discuss three very important ones: men's health, brain health, and safety. We'll be sharing preventative actions and choices you can make to ensure a healthy lifestyle. First up, men's health. Joining me via Zoom is Mike Leventhal, Director of Operations of the Men's Health Network. Mike, how are you, sir?
I'm doing fine, Vincent. Hope you are.
Oh, I am well. Thank you so much. So, big month coming up in June, obviously, men's health. Tell us about the history of this awareness period and why it's important.
Sure. Well, Men's Health Month started out as Men's Health Week, the week leading up to Father's Day. And it's just a special time of the year where we put the spotlight on men's health to raise awareness. And each year, mayors from all over the country and governors proclaim Men's Health Month in their cities and states. And it just gives us an opportunity to be able to work with public and private industries to get the word out and to encourage men to go to the doctor.
Yeah, absolutely. So tell us more about the actual mission of Men's Health in the programming that helps raise this awareness.
Yeah, Men's Health Network is a private nonprofit resource center whose mission is to reach men and their families where they live, work, and play and pray. We're dedicated to closing the lifespan gender gap and improving the lives of men and their families and communities by providing support, education, and advocacy. On average, Vincent, men live nearly 6 years less than women, and this lifespan gender gap continues to widen, and according to the CDC, it's the largest deficit in nearly 30 years. And so we lean into this. We work with partners to try to narrow this gap by raising awareness, prevention, and advocacy. And we believe men can learn from what women have been doing so successfully by embracing healthier lifestyles and advocating for the care that they need.
Why do you think that gap has gotten so big over the last 30 years? You said, that's an astounding number. Why do you think that gap?
We can talk all afternoon about that, but in short, it's because men just don't make health a priority.
Yeah, I guess so. We were talking about that off air. So what is the most important policy change that can directly affect male health?
Well, in my opinion, it's the creation of an office for men's health within the Department of Health and Human Services. Right now, there are 0 offices within that department that focus on the health of men and boys. And Men's Health Network has been pushing for many years to create this office for men's health. Working with Congress, we've created a Congressional Men's Health Caucus in order to tackle this issue, and we're making traction. So it's looking positive.
Well, you mentioned boys. Why is it so important to start this health journey early for young men and boys?
It's going to take a cultural change to affect men's health. Oftentimes boys stop going to the doctor after they get that last sports physical in high school to qualify to play sports. And so for us, we're trying to reach young men. We want to make them aware of their specific physical health needs and also mental health. Right. And fortunately, advocates that we partner with are really putting a spotlight on mental health in boys. It is so important that we're able to break down those stigmas and allow men to talk more about these issues that have been so sensitive, and they still are sensitive, but it's a cultural change, and it's a cultural movement.
Yeah, and you mentioned something very important. You talked about that last sports physical. Look, I'm a guy, I'm 52 years old. I hate going to the doctor to get that physical. I know I should. Why are screenings and things of that nature so important?
Well, early detection is critical. An ounce of prevention is worth a pound of cure. And so if you're able to catch something like prostate cancer in its early stages, it's almost 100% treatable.
Tell me about some of the resources folks can use to get involved in men's health.
Well, we're really excited about our new lifespan guide, our GAP guide that we have created. And what this does is it takes men on a journey to good health by allowing the participants to learn more about the importance of lifestyle changes. It demystifies the difficulty of adopting healthy changes, and it allows them an experience to see how men's health can transform your life throughout the years. And it's just all about making simple changes. And that resource is available on our website, along with all of our other resources that focus on head-to-toe men's health.
Yeah, let's talk about diet, right? How important is, we were talking about the donuts and the fries and the bread before we came on, but how important is diet, especially as we get older, to your overall health?
Well, we got to watch what we put in our bodies, don't we? I mean, we've got to make sure that we get plenty of exercise. We want to make sure we get plenty of sleep. We don't want to smoke. We don't want to drink in excess. We also don't want to eat in excess. And so for us guys, as we get older, we want to maintain a healthier lifestyle. We just have to watch what we eat. Stay away from some of the fried foods, the fatty foods, eat more clean, whole foods. That's what we promote at Men's Health Network. It's not about living that life necessarily 365 days a year. You can have your cheat days, and I hope, Vince, that you're like me and you have a few of those along the way.
Yeah.
But it's really important to kind of stay and maintain that path to proper diet and good nutrition.
Mm-hmm. Well, we talked about physical health, but we didn't really touch on mental health. And as guys, oh, I'm tough. You're not supposed to cry. Oh, just get over it. But
Right.
How important, and we've seen this in the last decade or so, how important is it for guys to be mentally healthy?
No, it's critical. I mean, we talk about the stigmas when it comes to men's health. We talk about being macho and not wanting to go to the doctor. We sure as heck don't want to go to the psychiatrist. And so when there are times in our lives where we're feeling blue, we're feeling down, we're feeling low, we need to be able to reach out. We've got to have a support system in place where we can share our experiences. And for guys, I think it's really important that guys have a tribe. We have a group of men that we're able to bounce ideas off of, talk about the things that are happening in our lives, and not make it to where we have to keep everything bottled up inside, because we know that's not healthy.
Yeah, absolutely. Don't keep it bottled up. And I'm guilty of it myself, and probably
Sure,
my
we all
son
are.
as well, right? Because he's
Yeah.
24, and he watched me growing up, and me being former police and Army, we kept everything inside. So yeah, mental health is definitely a key to men's health. All right, Mike, thanks so much for joining us on this very important topic. Now, for men to obtain good health, it's important to find balance, manage stress, get quality sleep, live a healthier lifestyle, and stay on top of important health screenings. My thanks to Mike Leventhal of the Men's Health Network for sharing resources. Small, manageable steps can lead to big results. For more information about men's health, visit menshealthnetwork.org. When we come back, we'll talk injury prevention and safety.
I debate all day. It's what I do. But there are some things that are undebatable, like your mental health, my own mental health. I was in a dark place when my brother passed away in a car accident. I've never been more devastated than the day I lost my mom. I was depressed, miserable, in ways I never imagined. I reached out, and my sisters came, my pastor, my therapist. They helped me get through it. I found that the more I spoke up, the healthier my mind became. The chaos that was in me began to subside. I was more focused, clear. When you love your mind, you can go so much further. That's not up for debate. Find mental health resources at loveyourmindtoday.org.
What are you doing in there?
What's that?
I wouldn't do that. What are you doing? What are you looking for?
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff.
Escúchame, en esta casa los hombres no lloran.
You alright?
It just feels like it's coming from everywhere.
Do you wanna talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
Well, June is National Safety Month, and preventing injuries is a major part of being safe. Each summer, emergency rooms see a surge in preventable injuries among children from burns, drowning, and heat exhaustion. Dr. Christina Brown, a pediatrician with Kaiser Permanente here in Baltimore, joins us to share how we can keep our family safe this summer and every day this year. How are you?
Great. Thanks so much for having me.
So why do we see an influx of injuries over the summer?
Well, kids are outside now. Yeah. They're getting active, getting into everything.
Yeah, I was one of those kids that would do the dumbest stuff, right? So what are some of the types of injuries you see?
Yeah, so they're getting outside, they're getting on their bikes and their scooters, often not wearing their helmets. So we're seeing a lot of head injuries that can be prevented with wearing those helmets. We're seeing some broken bones and fractures. So if they're on their scooters, they could be wearing their elbow pads, knee pads as well. Why
is it important? Of course, I'm in my 50s. This is long before we wore helmets, but why is that so important? Because especially what we know now about CT and other head injuries, why is that so important?
Yes, a well-fitting helmet can decrease your risk of head injury by about 85%.
Wow.
Yeah.
Wow. What about heat-related injuries? As kids, we like to stay out in the sun. We don't drink water, Gatorade or anything like that. So how can parents make sure kids are staying hydrated when they're out during the summer?
Yeah, so they should bring multiple water bottles to camp. You can even freeze your water bottle ahead of time so it can stay cool throughout the day and encourage them to drink it throughout the day.
So, of course, in the summer there's sports, the football, the baseball. What are some of the things children and parents can do to prevent those sports-related injuries?
Lots of stretching beforehand. That should be part of their routine. And being active in multiple kinds of sports so they're not just getting overuse injuries from one kind of sport. We see a lot of overuse injuries from the same throwing, the same movements over and over.
What do you mean overuse?
So if you're always throwing in that same pattern over and over, versus if you're training in multiple different kinds of sports, you're building up your strength in multiple different muscle groups.
So you're talking maybe a pitcher that's always just throwing that curveball.
Yes.
In the same. Wow. Interesting.
Even in young children.
Really? What's the youngest age you've seen when we're talking about these types of injuries?
9, 10. Yeah.
Yeah, I was probably one of those kids.
Yeah.
Of course, summertime, there's always travel. What are some safety tips parents and kids should know when they're traveling?
Yeah, well, seatbelts is the easiest one. Seatbelts, we know that those save lives. So making sure that your kids are in seatbelts or wearing age-appropriate, car seats, boosters, etc. And then having a plan for if you get separated at an amusement park, for example. Children should be memorizing their parents' phone numbers, young as 5.
Yeah.
Younger if you can.
Yeah, and speaking of numbers, it's also probably important that kids know how to call 911.
Absolutely.
Even not just for themselves, right?
Yeah, children have saved parents' lives by being able to call 911.
Yeah, it's stuff you don't think about as, a parent, especially as a child, to be able to call 911.
Yeah.
What else is key to keeping kids safe?
Pool safety is crucial. Yeah, so you need to have multiple levels of protection around a pool. So first you need a fence, regulation fence.
Right.
You can have an alarm on your door, so you can hear a ding even if someone is opening the door. You can have an alarm on the pool as well, so that if someone's going into the pool. Teach your kids to swim at a young age. Make the commitment to teach them how to swim.
Right. What about when parents send their kids off to maybe a Y or a gym that has a pool and the parent's not there to watch?
Yeah.
What are some things parents need to know?
Yeah, so you need to make sure, read the reviews of the places that you're sending your kid. Make sure that the lifeguards are certified, or if they're going to a party, for example, that the adult to child ratio is safe, that the person watching your child is, dedicated to making sure that your child is safe.
One thing we don't think about when we're talking kids' summer safety, there's a lot of households that have guns inside. And I know during the summertime, more guns are usually out.
Yes.
How important is gun safety inside a home?
Extremely, extremely important. So we're trying to normalize asking other parents if they have a gun at home and is it locked up. It's okay to talk about these things and to ask, what are your rules at home and how do you treat guns at home and are they locked up, and to have those tough conversations. Talk to your own kid about it. What if you found a gun at someone else's house? What do you do? How do you react? Think about this ahead of time.
Have you had to treat any gun-related injuries?
In children, no. No, in my training in adults, thankfully, in children, no.
Yeah.
I work in an outpatient setting now, so I don't see it as much.
What other services does your group offer?
So we see a lot of sunburns as well. So children should be always wearing sunscreen. It's non-negotiable. Children love to put up a fight about this, but if they want to be outside, especially in that 10 a.m. to 2 p.m. hours with the highest risk, they need to be in sunscreen, SPF at least 30. And they make all these rash guards now, right? With the short sleeves or long sleeves, even pants now they make for especially the young ones who, where it's hard to get the sunscreen on, or reapplying every 2 hours is tough.
Right.
Yeah.
So that sunscreen, though, should be applied to even people of color, right? Because being a person of color, I know in my household, we never grew up talking, oh, you need sunscreen. It's just like go outside, drink from the water hose, but we never actually talked sunscreen. So it's important across the board, right?
Yes, and protect your eyes as well. Yes. Yes,
maybe
protect
that's
your
why
skin,
I can't see.
Protect your eyes, wear a hat, wear the sunscreen, and reapply, especially when you get out of the water as well, or if you're sweating a lot with exercise.
How long does it take for a child to experience a heat-related injury? Is it pretty quick?
Well, it depends on how hot it is as well, but you can see kids at camp get overheated pretty quickly, especially if they skip breakfast or were up late the night before, didn't eat dinner well, they can get dehydrated more quickly. They get overheated more quickly than adults as well.
Yeah.
Gotta be careful.
Absolutely. Final thoughts on kid safety?
Yeah, talk to your pediatrician if you have questions about it. Prevention is key, and you can go to kp.org and find more information about it.
Perfect. All right. My thanks to Dr. Christina Brown of Kaiser Permanente for sharing risk reduction and injury prevention for our youth as we commemorate National Safety Month. To learn more about preventing injuries, visit the National Safety Council at nsc.org. Coming up, learning about brain health and Alzheimer's disease.
Gracie and Pedro might not get along so well.
You're standing on my tail.
But there's one thing they agree on. There's a right seat for everyone.
Oh, that's the good stuff.
Whether you're a dog,
Hold on, Pooch.
a cat, a fish, or a rat.
And I'm a ferret.
Be sure to travel safe.
How can you be so sure?
I'm absolutely positive.
On your next adventure, make sure your children are in the right seat for their age and size. Get it right at nhtsa.gov/the right seat.
All right, I'm in the house.
Okay, what do you see?
Nothing yet. Hold on. I think I just heard something. I'm heading upstairs.
Okay, I am almost there.
I'm in the bedroom.
Okay.
Oh no, it's not here.
What?
The gun's not here.
What do you mean? Where is it?
Cameron, are you in there? Open the door. Cam, come on, Cameron.
I'm worried about Mom.
Mom? She's fine. These the ones, right, Mom?
Yeah, groundlings.
Sweet potatoes.
Daddy, it's salty.
Some things come with age.
And some don't.
Early detection of Alzheimer's can lead to better care for your loved one. Learn the early warning signs at 10signs.org.
You're not gonna get it all right. Just make sure you nail the big stuff.
Mama!
Like making sure your kids are in the right seat for their age and size. Get it right at nhtsa.gov/the right seat.
Well, over 7 million Americans are living with Alzheimer's. Odds are dementia will touch your life in some way. June is Alzheimer's and Brain Health Awareness Month. a time to have conversations about cognitive health, addressing risk factors, and early detection of brain impairment and dementia are key. Marlon Massey of the Alzheimer's Association of Maryland joins us to discuss the warning signs and the importance of early detection. How are you?
I am doing well. Thank you so much for having me.
Yes, so 7 million people, I think I was sharing with you, my grandmother on my mother's side passed away from Alzheimer's back in 2007. But from what I can remember of my grandmother, there were no warning signs, but they were probably there. So let's talk about these warning signs.
Yes, well, there are 10 of the warning signs, and we just want them. One of the main ones is just not being able to do the things that a person has normally been able to do, where it affects their daily life. So that's number one that a person can start looking at.
Now, when you say things they normally do, how simple of a task are we talking?
How simple of a task? Let's just take, if someone is used to baking a cake, and let's say you end up tasting that cake, and you notice that the ingredients aren't right. So maybe instead of using sugar, they use salt.
Yeah.
You know, so different things like that.
Right. Yeah, I was watching a movie. I can't remember the name of it, but he was trying to explain college, but he couldn't get the word. He just kept saying, you know, the big school, the big school.
Exactly.
So finally she said college. So when you start seeing that communication start to slide, is that also a sign?
It is a sign, but that's by that time, a lot of times, a person has been diagnosed, but those 10 warning signs are crucial. So, but the main one, as I said, is just anything that interferes with the daily activities that a person is used to doing. So, but
how early are we talking though when we should start looking for these signs?
Well, when you start to see that a person is outgoing, let's just say you have a person that's really outgoing, and all of a sudden they stop wanting to do the things that they enjoy doing, we would normally think that maybe that's just aging.
Right.
But maybe it's not.
Right.
So that's a warning sign that's normally so subtle that people don't make that connection. So the age is different for each person.
Right.
But yes, so.
Because, you know, in our community, I remember growing up, we would call it the old people's disease, right?
Right.
But, you know, when I look at a person like a Bruce Willis, who's not really technically that old,
right.
I mean, are we talking 50s, 60s, or?
Well, there have been, again, normally 65 and older.
Right.
But anyone that's diagnosed prior to that, that can start in your 30s and 40s.
Wow.
Yes.
Wow.
Yes, but 65 plus is the normal age.
So I know when my grandmother was going through this, she had to take a cognitive test. What is entailed in that test when we're trying to diagnose this?
Well, different physicians use many cognitive tests, but one of the main ones, I think, is where they would go in and draw a clock, put the hands on it, remember some words that their physician gives them, and things like that. But that takes place every year under Medicare, where they can get that cognitive test done.
Well, let's talk prevention, you know, because there's all these over-the-counter pills and stuff that says, you know, it helps with memory, brain function. Does any of that work? Is there a cure to this?
There is no cure at this moment, but we are in the era of treatments. Only when a person has been diagnosed in the early stages of Alzheimer's and all other dementias. So the pills and things like that, no.
No? So I'm wasting my money, basically.
You need to check with your doctor, you know, for anything else that you're being given if you're just taking it with no diagnosis. But there is no cure at this moment. That's something that the Alzheimer's Association is definitely working towards.
What about demographic? I assume there's no race, creed, or color that this doesn't affect.
That is correct, but there is, as far as for the demographics, African Americans are 2.5 times more likely to be diagnosed with Alzheimer's or dementia, and the Hispanic Latino community is 1 time. So yes, we have the higher risk factors and rates of.
Do we know why that is?
Well, we do for some, for African Americans as well as for the Hispanic community. We have high blood pressure, obesity. Age, of course, is the #1 factor, 65 and over.
Right.
But yes, different factors like that,
So
risk factors.
even the factors we wouldn't think of, like being overweight or high blood pressure.
Those are, yes, they make your rates go higher if you're diagnosed with that. And the African American community have high rates of those
Especially
conditions.
the high blood pressure.
High blood pressure, vascular, dementia, things like that.
Wow. So is there anything we can do when we're much younger to, we can't prevent it obviously, but is there anything we can do to maybe slow progression down?
Well, there's always things you can do. #1, take care of yourself. It's nothing new, no new science in that. What's good for the heart is good for the body, it's good for the brain. So eat right, exercise right, challenge your brain, challenge your body, things like that. And you can find and receive that information at the Alzheimer's Association.
All right, last question with that. How does your group support individuals and their families?
Well, we have #1, a fabulous national 24/7 helpline. That number is 800-272-3900. We offer support groups, in-person, virtual. We have specialty support groups. When they call that 800 number, they can receive any type of information that they're looking for and where they need it. Maybe not just with the Alzheimer's Association, but with local agencies in their state.
Awesome. All right, we'll leave it right there.
All right.
All right, thank you, Marlon. To learn more, visit alz.org. If you have a family member that is living with Alzheimer's, caregivers can connect you with support 24/7 by calling 800-272-3900. Thank you for joining us and making community connections.